Hey everyone, welcome to the Doctor Series. I'm Samantha Frontera. I'm the host of the show. And today we're doing things a little different because we're actually doing a spin-off of the Doctor Series called the Patient Series. And this is our very first one. And I'm very excited because we are going to hear Braxton's story. His mom had originally reached out to me. Her name is Linda. And we also get to speak with his doctor as well today. So really excited to have everyone on the show. Welcome to the Doctor Series.
Thank
Hello.
you, Sam.
It's great to be here.
Great. So I think we're going to start off with Dr. Liam for Lori Children's Hospital, and he actually works in many different facets of the hospital. And he has been doing some gene therapy that he did with Braxton in terms of his case. So, for people that don't know what gene therapy is, why don't you tell us a little bit about that, Doctor?
Yeah, sure, Sam. So gene therapy is a very specific type of treatment where you take somebody's stem cells and you change them in a way that corrects for whatever genetic problem or genetic issue that you have. So in some cases, like sickle cell disease, you may change or introduce a new gene that then corrects for the genetic defect. And in other cases, sometimes what happens is you can directly modify or change the gene so that you can have that gene working the way it ought to be. So this is done in the lab, and then once you've modified those stem cells, you actually give them back to the patients. And we call that an actual transplant. It's like a stem cell transplant, but instead of having somebody else donate those stem cells, you're taking someone else's stem cells and you're changing them or correcting them.
That's amazing. And so, how did that really work in Braxton's case? Can you share a little bit more about that?
Yeah, so Braxton actually participated in a kind of a landmark clinical trial that we had here and at other sites where we used a virus that introduced a new gene into his stem cells that allowed his stem cells to make red blood cells that didn't sickle anymore. So Braxton has a blood condition called sickle cell disease, and part of the problem is that there's a genetic defect there that causes his red blood cells not to be normally shaped and instead take on this sickle shape. And when it takes on this sickle shape, these red blood cells can block the blood vessels in your body. It can cause a lot of problems, including debilitating pain, acute and chronic organ injury. And these red blood cells don't live that long either. And so you're anemic at the same time. So when Braxton participated in this clinical trial, we gave him his own stem cells back after we genetically modified them. And so it's a complicated process because once you take those modified stem cells and you give them back to the recipient, that patient could, in theory, kind of reject those stem cells. So you have to go through what's called a conditioning regimen where you get almost like chemotherapy that suppresses your immune system so that your body can accept those corrected stem cells back into your body.
Wow, that's fascinating. And in terms of his case specifically, what were some of those obstacles? Were there, if any? Because it sounds like, of course, it was successful. We're going to be talking about success today.
Yeah. I don't think that there were a lot of obstacles other than the fact that when you participate in a stem cell transplant or gene therapy trial like this, it takes a lot of time, effort, and coordination of care. I think that, participating in any clinical trial from a patient standpoint takes a huge leap of faith and commitment to the scientific method. And it's only in this way can our field kind of move forward. So patients such as Braxton have made a lot of sacrifices to participate in a trial like this. And with their commitment, the field kind of will advance. From a coordinating standpoint, however, in order for Braxton to have participated in this trial, we had to screen him to make sure he was an appropriate candidate for this gene therapy, just to make sure that he wasn't going to be at higher risk for certain side effects. Then he had to go through the process of collecting his stem cells. The stem cells then went to the lab to be corrected or genetically modified. And then he had to be hospitalized so that he can get the chemotherapy to suppress his immune system. The stem cells were given back to him. He stayed in the hospital for a specific amount of time, and then he would come back to the hospital frequently so that we could monitor him closely. And to participate in this trial, it's a huge commitment because you're followed monthly to every every 3 months for a couple of years. And then after that, we follow you for up to 15 years just to make sure that there aren't any long-term consequences or safety concerns with being in a gene therapy trial like this.
Absolutely. That's amazing. And so how do you specifically feel about the success of this trial and how well it's done for Braxton so far?
Yeah, we've been completely ecstatic with the success of Braxton, having gone through this gene therapy. He's coming up on about 2 years after his transplant. In fact, I just saw him in clinic yesterday for follow-up. And when you look at his blood counts, his hemoglobin is now normal, which means that he's not anemic anymore from the sickle cell. He has evidence that he is making, that he's taken on these modified stem cells and he's making non-sickled red blood cells, which will continue to, reduce his risk of complications overall from the disease. Since he's had this transplant, he's not had any major sickle cell related hospitalizations or complications, and we're just so grateful for that.
That's amazing. Well, great work with that. Anything else you'd like to add before we go to Braxton about his story in terms of just the future of gene therapy? Will we get to see more advancements, you think?
Yeah, absolutely. This sort of a process takes a long time from conception to implementation, and so our field's been working on gene therapy probably for the last 30 years or so, many decades. And it starts off with the idea of doing gene therapy in the lab, then it goes to animal studies, and then first in human studies to test its safety. And then all of that data, safety and efficacy data, gets put into an application to the FDA so that it can eventually be approved. We're probably still a ways away from that, but we're making good progress. And I guess as a final word, I just wanted to, thank Braxton and his mom, Linda, for again making those sacrifices and the time commitment to be in this clinical trial, because with their participation, it's really helped the field move forward, and I'm really grateful for that.
Absolutely. Well, that's amazing. And so, Braxton, you've obviously gotten the opportunity to listen to your doctor talk about the success, but you're living proof of this success. But let's start from the beginning a little bit. So, when were you diagnosed with sickle cell anemia?
Well, I was born with it. This is the sickle cell is not it's what I'm trying to say. It's sickle cell. I was born with it, and we can and uh well again we were born with it. So I lived throughout my whole entire life since I was 27 with it, and I went through so much pain crisis and hospitalizations and medication to go to cure to help my pain,
Mhm.
basically.
Yeah, and that obviously is a grueling journey. So, tell me a bit more about how you feel about being part of a study or the clinical trial that has like done so well. Like, how do you feel about the success of this? Are you feeling any better?
I feel amazing about this, and every day I used to struggle with pain all the time, and now I can go throughout my life not going through pain, and that's a miracle and that's a blessing that I never knew that I was gonna have.
I think that's amazing. And so, tell me, what was like your pain level before you started participating, and where is it now?
Oh, my pain level before that it was I can't there was it was 10. It was on
Mhm.
like it was above 10. I had unbearable pain going through it. And now since went through the grueling procedure, I've now feel so much better and I'm having 0% pain in my body. Every day I'm healed.
That's amazing. And so, your life has changed drastically then. So, do you feel like you're able to go about your everyday life a little bit differently now?
Yes, yes. I can do things that I never thought I could ever do in my life. And I feel like I can do whatever I want without knowing that I'm going to go through a pain crisis. I don't have to stay in my like in my realm of hospitals and stuff. I'm free of it now. I have dreams that I'm gonna go out and pursue because I don't have it anymore. I have nothing to stop me.
Yeah, it definitely opens up a lot of doors for you.
Yes, yes.
That's great. What would you say to anyone else who's going through either sickle cell anemia or other medical issues? Would you have any words of inspiration of how to push forward when it comes to that?
I would tell them fight every day, stay faithful, and one day you will be cured of sickle cell.
That's great. And I'd love to hear a bit from Linda, your mother, who seems to be, someone who's near and dear to your heart and really fought to make sure you do have a good life and that you stay here with us in this life. Linda, what has this process been for you?
Well, initially, Sam, it was very scary, especially when we first went over all the details of what this gene therapy process would be like. I was really scared. Just even the consent form was so intimidating. It was like a book, of all the things that could possibly go wrong. And thank God nothing has occurred with Braxton. But I was really nervous early on, and we talked about it, and we made the decision to move forward. When he was in the hospital going through the process, it was, as he said, it was grueling. The chemotherapy that he went through, and there were different changes like every single day that we noticed. But I was there. I put Bible verses around his bed. We would pray. It was during COVID, so he couldn't have any visitors. He couldn't leave the room. But we made it through. I was even maybe midways thinking that did we make the right decision? But we definitely did. Yes.
And so what kind of led you to that conclusion that like we definitely did? Is it the success and what improvements have you seen in your son?
Oh my gosh, his energy level. You know, I, Braxton, I don't know. I'm sure you're okay with me sharing this. Braxton used to think that he was going to die. He was going to have premature death, and as as well as he I could understand why he felt that way. His older brother Brandon, he died at 27 years old from sickle cell, and so after that, Braxton he gave up on life. He would say things to me like, why go to college? I'm not going to live long anyway. And I hate to say this, I don't think I've ever even shared this with Braxton. I kind of was thinking the same. We saw young people around us dying. He lost his best friend at 24 years old as well. So he basically given up on life. And now he has a life. He has dreams. He's doing things. He's back in college. He's taking classes now. Before, when he took college classes, he'd always have to end the college class with a medical withdrawal because he'd always get sick or hospitalized. Yeah, always having pain crisis. And Dr. Liam can attest to this, all the near-death encounters he's had in the hospital. Yeah. Dr. Liam be there holding my hand and, just telling me to pray and hold Braxton's hand that he'd make it out of ICU alive, basically. Yeah.
Yeah, that's amazing. And just from a standpoint of obviously, I know you had shared with me prior to us doing the doctor series about your loss of your other son from
Yes,
the
Brandon.
same, yes, from the same disease. So how does it feel to have Braxton here with us today? How does that feel as a mother?
Initially, I must be honest with you, it was bittersweet because Braxton and I both have talked about this and we felt the same. And even when he was going through the gene therapy procedure, we hate that Brandon didn't have the opportunity to go through this and be cured as Braxton is. But I'm really grateful and ecstatic that Braxton is. But I wish my other son had had the same luxury. So we've learned to just move forward with that it wasn't Brandon's time to have something like this done. And I'm just amazed, my whole family, at what we see with Braxton now. His whole attitude towards life has just changed. It's just amazing to see this happen. Yeah, he's doing things that he only thought about doing before.
Yes,
Yeah.
it's very encouraging and inspirational. And my last question to you, Linda, is Mother's Day is just around the corner. And so, as a mom, is there anything advice you would give to other moms who are either on this journey with their child or on another medical journey with their child?
I just have patience, have faith, have hope, ask questions about things that you don't understand, find out like what you should expect. The let your medical team know what you need as you go through your journey. Yeah, and I say just have faith and have hope, because we had it, and look at what happened for us. Look at the outcome.
Amazing.
Mhm.
And I just think it's great. And Dr. Liam, just my last question to you. If anybody wants to learn more information about gene therapy, is there a place we can send them to?
Yeah, our hospital isn't the only hospital that is open for these clinical trials that involve gene therapy. There are a few hospitals out there. I would say that, you can look on our website for Lurie Children's and learn a little bit more about gene therapy. And I think that the Sickle Cell Disease Association of America has really good information on gene therapy. But there's a lot online about gene therapy right now. It's kind of the wave of the future for treating sickle cell disease and other blood disorders. And I think we're just gaining a lot of momentum in this area. So it's an exciting time for patients who, like Linda and Braxton said, who have lived in fear and in pain with sickle cell disease. Having this option of gene therapy really offers a beacon of hope for them.
Yeah, absolutely. Braxton, anything else you'd like to share as we end the episode?
Yes. The procedure was really, really grueling throughout the whole entire ordeal. But when you make it out of it, you won't regret what you did at the end. You will have great life, and you will have long life.
Yes. Amen.
Amen. That's important. Well, thank you guys, everybody, for being here today. I am just so grateful that everyone was able to make the time and we're able to come together and educate and inform. And Braxton, we're so happy you're here with us today. And thank you for sharing your story with us.
Of course, you're welcome.
Thanks.
And thank you for inviting me.
Absolutely. All right. Well, thanks so much, guys. Take care.
Thank you, Sam.
Okay, thank you for the opportunity.
Bye, Braxton. Bye, Linda.
Thank you. Bye, Dr. Lee.